Lisa Alvarado, licensed professional counselor. So today I want to talk to you about the different licenses that there are in mental health. Sometimes, especially if you're not in treatment, a lot of people use psychiatrists and psychologists and therapists and psychotherapists all in one, and we're all different. We're different in our training and in our license. So the first one, the most common we always hear is psychiatrist. So psychiatrists are actually medical doctors. They're the only ones that can actually prescribe you medication. Psychiatrists and also nurse practitioners. Nurse practitioners can also prescribe pretty much anything. So if a nurse practitioner works in mental health, then they can also prescribe your antidepressants, anti-anxiety. But usually a psychiatrist is the one that gives you medication. Depending where it's at, once upon a time, psychiatrists actually did therapy, and some still do, but most of the time you don't see that a lot, especially with managed care, which is what insurances really pay for your services. Sometimes you see a psychiatrist for less than an hour for an evaluation. They give you diagnosis, treatment, and sometimes the very same day they give you medication. A lot of people really don't like to take that route, or at least that should be the last option. I always recommend medication use be the last treatment. There's other things that you can do first instead of turning to medication right away, because they're not magic pills. They don't change your environment. They don't change your living situation that can be causing some of your symptoms. But sometimes it is helpful. So remember, a psychiatrist, they're medical doctors. They go to medical school. That's 8+ years of schooling, and they treat the body and give out medications. Some do some therapy, not a lot though. Most of them just kind of give you the prescription for medication. Then you have your psychologist. So psychologists are PhD trained, so they have a doctorate degree. So they're doctors because they have a PhD, not because they go to medical school. So usually with psychologists, you'll need at least 10+ years of grad school. So you go to get your bachelor's degree for 4 years, and depending on the program, sometimes you go to your master's and your doctorate, but sometimes there are programs you go straight after your bachelor's degree and you go straight to a PhD program. And psychologists, most of them, depending on their training, they can do a lot of testing and evaluations. I think pretty much psychologists can only do certain types of evaluations. So for example, you see them a lot in schools because they do a lot of learning disability testing or evaluations for IEPs for school, which is individual education plan. A lot of psychologists do that because a lot of their training has to do in testing and research. Psychologists, of course, they also do a lot of therapy, but that again depends on your training, which kind of training program you do in grad school. If it's a clinical and counseling psychology doctorate program, then most of their education and background is going to be in diagnosing and treating mental health disorders. If it's more of a research-based program, then a lot of them are going to know how to do different testing for learning disabilities, for IQ testing or personality testing, for custody evaluations for court. You usually want to see a psychologist. A lot of them have that kind of background. Then after that, you also have a licensed professional counselor, which is what I do. And with a licensed professional counselor, again, depending on the program, I know I did mine in clinical and counseling psychology, so all of education, all of training has to do with diagnosing and treating different mental health diagnoses. LPCs are typically a master's program, so that is between 6 and 8 years. So to be licensed, it would have to be 8 years. So you do 4 years of schooling for your bachelor's, and then typically 2 or 3 years for your master's. And then after that, when you're done with your master's, then you have to do minimum 2 years post-master's, which is about 3,000 hours of face-to-face experience, which if you do it full-time, it comes out to 2 years. By the state, at least in Pennsylvania, we have 6 years to complete it, but the minimum you can do it is in 2 years. So if somehow you're able to do it in 1 year, which is super, super hard to do, you still cannot sit for your exam. So usually total would be about 8 years for you to be able to sit for your state license. And your license what makes you obviously a licensed professional counselor. Some therapists do a master's degree and they can work at a nonprofit. They don't have a license, but very limited to working at a nonprofit or certain types of jobs. Once you have your license, now you're pretty much open to have your own practice, to work for big hospitals, because when you have your license, now you can bill insurance. So if you're looking for a therapist and you see a therapist that's not licensed, most likely your insurance is not going to pay for them, so you're going to have to pay out of pocket. So typically when you have a licensed professional counselor, we're credentialed and we can take insurance companies. Then similar to LPCs, then you have your LMFT, which is your licensed marriage and family therapist. So we're actually all under the same umbrella: licensed professional counselors, licensed marriage and family therapists, and licensed clinical social workers. I'll get to that in a second, but we're all under the same licensing umbrella and under the state, at least in Pennsylvania. With licensed marriage and family therapists, a lot of the background is similar to LPCs, but then a lot of their training, and they have extra coursework on marriage and couples therapy specifically. And then similar to that, you have your LCDC, which is a licensed chemical dependency counselor. So again, the same similar coursework for as a licensed professional counselor, but they're more focused on drug and alcohol counseling. So if you're looking for addictions counselor or such, then you want to see an LCDC. Most of all of ours is about 6 to 8 years to complete of schooling. We can do pretty much the same thing as psychologists. I have seen in certain places, my kind of level of therapist called a master's level psychologist. I personally don't like to call myself a psychologist, is because a lot of people think that's automatically the PhD, and I'm not a doctor, but I am a licensed professional counselor. If you practice psychotherapy, which I do a lot of, then you can be considered a psychotherapist. So anyone can really do psychotherapy, whether it's psychiatrist, psychologist, or licensed professional counselor. It depends more on your training and background. And psychotherapy, it goes a little bit of deeper work. I like to, I guess the simple way to explain it is with counseling, we're more doing guidance, and sometimes we're working on specific goals, such as if you're looking for career counseling, not sure what to do with, you want something better but not sure what to do, or you don't really struggle with severe symptoms of mental health disorders, but you still need that guidance, then that's definitely the counseling piece. If you have a lot of background issues such as, abuse and neglect in your childhood, traumatic experiences, a lot of trauma in your life, unresolved issues, definitely want to look into some psychotherapy. That's a little bit more deeper work. Now then, social workers, there's actually two different branches. You have your regular social workers, so you also have, that's a master's degree level social worker. So a lot of their background is more on social work. They do some therapy, but it's more about how the community, how the environment affects a person. Where in psychology, we're looking at the individual, with social work is looking more as the community. So you can have a master's in social work, but you cannot bill insurance. So if you see, you're trying to look for a therapist and you're looking at a social worker, they do not have a clinical license. You can even be a licensed social worker, but it's not a licensed clinical. It's very confusing, but it is very, very different, because health insurances do not recognize a regular licensed social worker. They're not going to cover those services. What you want to see then is a licensed clinical social worker. So licensed clinical social worker, LCSW, do this pretty much the same training as myself, LPCs, but they have a little bit more coursework on social work. Interestingly enough, Medicare, the insurance for elderly or people on disability, a lot of Medicare actually only will pay for services from a psychologist or licensed clinical social worker. Don't know why. LPCs have been advocating for many, many years, even when I was in school, and it's still not happening. But for that insurance specifically, they're the only two people that they'll cover, and psychiatrists, of course, but not licensed professional counselors. So you have, those are the differences. Depending on what you're dealing with, what's going on, then you want to really, at the end of the day, see someone that has dealt with and has more knowledge about your issue. So again, if you are struggling with drug and alcohol, you're trying to recover and get over this addiction issue, then you want to see a counselor that specializes in drug and alcohol dependency. That's your LCDC. If you're looking for couples therapists or you have issues within the family, then you want to see a licensed marriage and family therapist. If you're looking for more individual work, even couples and stuff, but usually more individual work, then maybe a licensed professional counselor. If you're looking for some kind of evaluations for court, anything court, whether it's for custody trials or IQ testing, personality testing, then that would be more your psychologist. If you're looking for medication, then you want to see a psychiatrist. It could be a little confusing, but once you're in treatment and you kind of get a little bit more educated with these, you'll see that there is a big difference. Okay, you have any questions about this or want to share your experience, please leave a comment below. And as always, subscribe and like this video or share it with someone that you know it could help. Thank you and take care.